Hello, everybody. I'm Dr. Shama Sultana, uh, founder of YNHC and chairman and co-founder of Hopewin Hospitals. Today, we are on the main topic, that is menopause. And also today we will discuss few points on osteoporosis, as today, as October 20th is celebrated as Osteoporosis Day, and October 18th is celebrated as Menopause Awareness Day, World Menopause Day. So today's our topic is dignified menopause is human right, not a privilege. So let's start with our presentation. So what's the menopause? Menopause, it's also known as the climacteric condition and is the time in most women's lives when menstrual periods stop permanently and they are no longer able to bear children. And menopause typically occurs between 49 and 52 years of age. Then what is the pathophysiology? See, the number of primordial follicle decline even before birth, but dramatic just before menopause. So there is an increase in FSH, LH from about 10 years before menopause, and due to and close to menopause, there will be few changes as listed below, that are anovulation, inadequate luteal phase, that will lead to decreased progesterone but not estrogen level, and that lead to DUB, that is dysfunctional uterine bleeding, and endometrial hyperplasia. At menopause, dramatic decrease of estrogen lead to menstruation stops, ceases, and symptoms of menopause starts. But still ovarian stroma produce small androstenedione and testosterone due to increased LH action on stromal cells. But main postmenopausal estrogen is estrone produced by peripheral fat. So what are the etiological factors? See, there will be a natural decline of reproductive hormones, and due to hysterectomy, or due to several causes like fibroid uterus or any other cause, hysterectomy was done. So in them, these etiological factor will develop. Then chemotherapy and radiation therapy. In these, cancer therapies can induce menopause and causing symptoms such as hot flushes during or shortly after a course of this treatment. Then primary ovarian insufficiency, and due to removal of ovaries, that is bilateral oophorectomy surgery, also causes this type of symptoms. And also ceasal of menstruation, that is menopause. So what are the signs and symptoms we see in menopause? Irregular periods, vaginal dryness, hot flushes, night sweats, sleep problems, loss of libido, mood changes, weight gain and slowed metabolism, thinning hair and dry skin, loss of restfulness. In this chart also, as you see, irregular periods, vaginal dryness, hot flushes, sore or tender breast and chills, night sweats, sleep problems, headache, weight gain and slowed metabolism, mood changes, thinning hair and dry skin, and memory problems as well. Then what are the different tests we do? Tests typically are not needed to diagnose menopause, but still follicle stimulating hormone and estrogen, that is estradiol, because your FSH levels increase and estradiol levels decrease as menopause occurs. Then thyroid stimulating hormone, because an underactive thyroid, that is hypothyroidism, in case of hypothyroidism, can cause symptoms similar to those of menopause. So what would be medical management? As we all know that we have to understand that a menopausal or perimenopausal stage is understandable, but still it brings anxiety to some. So we have to go to a gynae to solve the problem entirely, but not by ourselves. It brings up to the another problem. So please consult your gynae and tell your symptoms, what all you're having and why they are having, and go for the treatment. So menopause requires no medical treatment. Instead, treatments focus on relieving your signs and symptoms I have listed and preventing or managing chronic conditions that may occur with aging. So treatments may include hormone therapy, that is estrogen therapy remains by far the most effective therapy option for relieving menopausal hot flushes. Then depending on your personal and family medical history, estrogen is the lowest dose needed to provide symptoms and relief for you. And if you still have your uterus, that means you will need progestin in addition to estrogen. So estrogen also helps prevent bone loss, and hormone therapy may benefit your heart if started within 5 years after your last menstrual period. So another is vaginal estrogen we use. To relieve vaginal dryness, estrogen can be administered directly to the vagina using a vaginal cream, tablet, or ring. This treatment releases just a small amount of estrogen, which is absorbed or by the vaginal tissues. It can help relieve vaginal dryness, discomfort with intercourse, and some urinary symptoms. Then low dose of antidepressants you can take, but with only advice of your gynec or physician. Then certain antidepressants related to the class of drugs called selective serotonin reuptake inhibitors may decrease menopausal hot flushes. A low dose antidepressant for management of hot flushes may be useful for women who can't take estrogen for health reasons, or for women who need an antidepressant for a mood disorder. So here gabapentin is approved to treat seizures, but it has also been shown to help reduce hot flashes. So this drug is useful in women who can't use estrogen therapy and those who also have migraines. So in medications to prevent or treat osteoporosis is seen in most of the women of postmenopausal. So depending on the individual needs, doctor may recommend medication to prevent or treat osteoporosis. So several medications are available that help to reduce bone loss and risk of fractures. So few tips we will discuss, like cool hot flashes, like you have to dress in layers and have a cold glass of water or go somewhere cooler and try to pinpoint what triggers your hot flashes. Like for many women, triggers may include hot beverages like caffeine, coffee, like that, and spicy food, alcohols, and due to stress and hot weather, and even a warm room can trigger her hot flashes. So decrease vaginal discomfort. So use over-the-counter water-based vaginal lubricants or moisturizers, and choose products that don't contain glycerin, which can cause burning or irritation in the women who are sensitive to that chemical. So staying sexually active also helps by increasing blood flow to the vagina. So another thing is get enough sleep. Sleep is very important. Then avoid caffeine, which can make it hard to get the sleep, and avoid drinking too much alcohol, which can interrupt sleep. So mostly it is not seen in Indians, but still we see in a large scale in any of the community, either means middle class or low middle class or upper middle class. We'll see few means alcohol consuming women. So in them, they should avoid drinking too much alcohol, which can interrupt sleep. So exercise during the day, and although not right before bedtime. If hot flashes disturb your sleep, you may need to find a way to manage them before you can get adequate rest. So practice relaxation techniques such as deep breathing, paced breathing, guided imagery, and massage and progressive muscle relaxation can help relieve menopausal symptoms. You can find a number of books, CDs, and online offering and on different relaxation exercises which can practice and make yourself feel better. So we have to take a balanced diet, and that includes a variety of fresh fruits, vegetables, and whole grains. Limit saturated fats, oils, and sugars, and ask your physician or provider if you need calcium or vitamin D supplements to help meet daily requirements. Then exercise regularly, get regular physical activity or exercise on most days to help and protect against heart disease, diabetes, osteoporosis, and other conditions associated with aging. Then smoking, don't smoke. Smoking increases your risk of heart disease, stroke, osteoporosis, cancer, and a range of other health problems. It may also increase hot flashes and bring on earlier menopause. So what all complications you get in menopause, that are heart and blood vessel diseases. When your estrogen levels decline, your risk of cardiovascular disease increases. So another is osteoporosis. This condition causes bones to become brittle and weak, leading to an increased risk of fractures. So urinary incontinence is also seen in menopause, postmenopausal women, as the tissues of your vagina and urethra lose the elasticity. You may experience frequent, sudden, strong urges to urinate, followed by an involuntary loss of urine. So another is sexual function. Vaginal dryness from decreased moisture production and loss of elasticity can cause discomfort. And weight gain. Many women gain weight during the menopausal transition and after menopause because metabolism is slowing down. So let's see few points on the osteoporosis, as today is a World Osteoporosis Day, and in both there is a theme on bone health improvement. So theme for our menopause, World Menopause Day theme is also bone health. So let's see few points on osteoporosis. Osteoporosis is caused by an imbalance between bone resorption and bone ossification. So bone resorption is greater than bone growth in osteoporosis. After the age of 30, there is an imbalance in skeletal turnover. So osteoporosis is considered to be a silent disease. However, one may watch out for the following signs and symptoms, like early signs are due to low mineral density in the bones. The hand grip is weakened. Then weak and brittle nails may indicate a lack of bone density. Then what are the later stage symptoms, like loss of height as a result of spinal compression? Then induced by weak bones, the person tends to become an inch or more shorter over time. Then small curvature of the spine leading to stooping or bending forward, that is kyphosis occurs, may occur as a result of compression fracture of the spine. And shortness of breath. A weak bone causes a compression fracture of the spine. A collapsed vertebra puts pressure on the lungs, limiting lung capacity. Then bone fractures. Bone fractures can develop even with a powerful sneeze, cough, or the tiniest twisting of the leg due to weak, brittle, and fragile bones. Then pain in the lower back and neck caused by osteoporosis related compression fractures of the spine. So few of the vitamin D and calcium rich foods, and which are the osteoporosis preventing food, like you have to take pineapple, almond milk, coconut oil, prunes, apple, sesame seeds, and dark leafy green vegetables, coriander, green tea, green peas, cabbage, and omega-3 fatty acids, and calcium-rich foods like as listed here, like broccoli, potato, corn flour, and corns, and you have a variety of fish, chicken, and other dry fruits, leafy vegetables, dairy items. All this will fetch for calcium-rich foods. Then vitamin D and calcium can lower the risk of early menopause as well. Early menopause increases the risk of heart disease and osteoporosis. So these are the few essential nutrients for menopause diet, that is iron, fiber, probiotics, prebiotics, selenium, vitamin D and antioxidants, potassium, proteins, calcium, healthy fatty acids, and plant estrogens. With all these, we conclude this topic as all deserve a dignified menopause, and it is a human right, not a privilege. So all the best, ladies, and thank you.